Hi, I'm Dr. Stephen Olmos, and I'd like to share with you some techniques on digital scanning. So we're going to be using the Trios system so that you can get an effective scan quickly and also accurately, and make sure that the laboratory has all the data they need to produce whatever type of appliances or that you would be making. So we will get started.
So to start off, things to look out for, things that can cause issues that we found are excessive saliva, any type of metal filling, metal gold crown, and really the tongue. Making sure that the mouth is dry, keeping the tongue out of the way, and just knowing that areas where restorations have been done are going to need, more time on that area to capture the image correctly. Those will help you, gain what we're looking for in terms of capturing enough anatomy for us to make the whatever device you guys are prescribing. And so we'll start scanning the lower arch. And so what's really important is you want to make sure that you rock the wand as you're doing the occlusal surface. What this will do is it'll prevent capturing what we call a double image, which happens a lot of times on the incisal edge of the cusp. And so if you rock the wand left and right so that you capture the occlusion and a little bit of the buccal, a little bit of the lingual as you're passing through the mouth, it'll avoid allowing the program to create those kind of errors. And so it doesn't matter if you start on the left or right side. You do want to try and use the tip of the scanner to help you keep the tongue out of the way or block it in that sense. And so I'll start here on the left side. And so you'll see as I go through, I'm rocking. And then at this point, you can either choose to go lingual and just sweep it, or you can go the buccal first and then follow up on the lingual. It really doesn't matter at this point, as long as you make sure that you have the tissue there. I usually stop once I get to this point, just because it's hard to rotate the tip of the wand. And so I'll stop, grab it again, double click on the area that I want to start scanning again. So wait until that sees it. And I'll just do one pass over just to make sure. Now it's really hard to see with if you have a color scanner, it's really hard to see, errors when the tissue and the reflection of the teeth and saliva and everything are there. And so I like to hit the surface button so that it creates a stone image, or it looks like a stone image. You can really see, areas that you've missed, or if there's a double image or anything of that sort. And so everything here looks really good except for this area here on the canine and bicuspid. So I'm just going to go and double click that area and just re-hit that spot to make sure that we have that accurate. And so it's not entirely necessary to go and clean off the excess. You can if you'd like. Anytime there's tissue that's impeding on the teeth or the area that we need to make the appliance, that's when it might be a good idea to come in and just delete out the excess material there. But the things in the back and on the sides here, you don't really have to waste your time doing that. Our staff here in the lab can reduce that. But if this material was really close to the cusp tip or the tooth here, then I'd recommend that you guys move those out of the way. There's still a little gap here that I do want to correct. Anytime you have a missing space that's on the inside, on the cusp tip or the edge of a tooth, those are things that we don't want the program to fill in, because its estimation might not be accurate to the patient's actual anatomy. And so I'll go in and just make sure that we capture whatever's going on there. There we go. Little hole there, forgot. And so it's important to go through and just make sure that you're not leaving out any areas on the cusp tip. It's where the program has to guess what it's looking at. Why won't it capture that? And there's going to be times where it just gives you a really hard time to get it. There's enough there to where it's all captured now. So I've created a hole here on the front of the mouth just to kind of show you what happens if you do make a mistake. Especially if it's on the facial or the lingual side, it's real easy just to go and delete out that area. Sometimes if it's on the cusp tip, it'll give you trouble because you might create that double image that we were trying to avoid in the beginning. And so just to show you kind of, how you can correct an error that is wrong without having to rescan the entire mouth, you just delete that section out. And then you go back to the scan, double click to an area that you have captured completely. So these front teeth, and then I'm just going to sweep it right across here. And there we go. And so ideally we want to have, a few millimeters below the gingival margin in the event that we need that for retention. And little micro holes and spaces like these here are fine. The program will fill those in accurate. The tori here, you do want to make sure that you capture that if the patient, does have tori, whether it's lingual, buccal, and that way we can make the appliance appropriate to not be impinging on that area there. And it does look like there's some sort of double imaging here, but those are actually on his teeth. It looks like he may have some composite bonding of some sort. Last thing to look out for is the image count. Now the image count on this is really high, 1600. You want to try and keep it between 500 and 1000 per arch, simply because it reduces the file size. There's not really a downside to it other than the wait time and loading to send a case through. But if you're doing a whole bunch of scans in a day, then that could cause an issue. And so try and keep this number between 500 and 1000. Obviously it's higher right now because I'm trying to show different portions and different errors that can occur. And so we'll go ahead and move on to the upper arch. Now the key things to capture for the upper arch is obviously incisal papilla and the hamular notches. I understand some patients, especially with the size, depending on the scanner you have, the size of the wand tip can cause issues, but if at all possible, it really does make a world of a difference in our fabrication process to have those hamular notches to be able to make it appropriate to where on delivery you don't have any occlusal changes or adjustments to make. And so same thing, just like with the lower arch, I'm going to start on one side. I'm going to rock the wand all the way through and then just choose either lingual or buccal. On the lower I went lingual, so I'll show you going on the buccal on the upper here. So we're just going to rock him through. I'm just going to stop so I can switch the angle of my hand. And again, anytime you stop, you want to make sure that you go back and double click onto an area, and so you know exactly where your pickup point is. Ooh, where'd we go? And so now I'm going to go buccal. Basically, I'm just going to take it and wrap it right along the edge there. Perfect. Created a double image. which I wanted to show you guys. And then bring it across here and go lingual. And so ideally, this is what you're looking for in terms of the amount of amount to capture. So we have the hemial notches back here, right here and here. We have enough coverage of tissue going along the lingual and buccal. We have some areas here. So the areas, these little guys, those are okay for the program to fill in. If this red area reached the cusp tip here at all, then I'd have to go back and rescan that area. So these guys over here, the interiors, we're going to want to rescan that because it's creating basically a guessing game for us. I believe that's where the double image started to create. And so when I say double image, this one's really, really close, but you can see it. And so what happens is basically there was a shift in the scan. And so from this point on, all of this area here will be slightly tweaked this way where the occlusion actually goes along the actual anatomy of the patient. And so it's important to recognize those kind of things as it'll become a fit issue on delivery. And so same thing, we can go and we can delete out these cusp tips here, the area where we're not sure is accurate or not. And I do recommend completely getting rid of all the material in that area, because again, we don't know if the scan that was surrounding that double image was accurate or not. And so what I'll do from here is I'll start back over again where we have, you know, an accurate scan. And so on these back two teeth, and then I'm just going to sweep it forward to recapture that. So that's the, what side is that? This side. Here we go. I'm just going to come. Let's see these spots we missed over here. And that should be good. And so you'll see here we got rid of those double images. Everything is nice and smooth now. We have all the areas captured. There's a little hole back here, which I'm going to go and capture. And then we'll be able to scan the bite registration. There we go. Perfect. Again, excess tissue here is not really necessary to trim away. And then the material over here, again, if that was closer to the tooth, I'd ask, you know, it's best to trim that away. But next step would be the bite registration. It's very important, it's for all 3Shape users at least. Down here at the bottom left, you'll see there's a bite 1, a bite 2, which basically references to the right side and to the left side. You want to make sure that after you scan the right side or the first side, that you go down here and click on this button to scan the other side. If that's not done, a lot of times it'll send through, and the algorithm that the software has to match up the relationship of the upper and lower arch will basically be tweaked, or it'll create a cant that the patient doesn't really have. And I'll show you that in just a moment. So now with regards to scanning the bite registration, there's two techniques that we've came up with. One is that you take the bite posteriorly, like normal. After taking the bite, you want to remove it from the patient's mouth and cut down the buccal flange, which is basically going to block the scanner from being able to recognize the teeth to match it up properly. And so you want to cut it down pretty good to where you just have the contact points in there. It's not entirely necessary to cut down the lingual portion. However, if you do, it'll avoid any issues with the patient not being able to come down completely into it or interfering with interproximal piece or something of that sort. The other technique is to just have the bite registration anteriorly. And so our green bite registration we recommend for taking traditional bites. The pink bite registration we recommend if you're just scanning, you're not going to send it to us. One, it's less expensive, and two, it's a little more rigid, and so you can lock the front teeth in, whereas I don't have to cut down any of this. I can just leave it in the patient's mouth, and then I'll be able to scan the posterior region of the left and the right side of the arch, because that'll be clear with material. And so I'll show you scanning both of them just to see the difference between the two and the ease of how the scanner should pick up the relationship. And so I just want to show you what I mean by cutting down the buccal flange so that you can see the actual facial side of the teeth. All right, so now I'm going to show the process of scanning the bite registration. On the bottom left here, there's two boxes. One says bite 1, the other says bite 2. Bite 1 is for the right side of the mouth, bite 2 is for the left side of the mouth, and I'll show you the importance of those two buttons in just a second. So we'll go ahead and start scanning. What you want to do is just start on one arch and basically sweep from either anterior to posterior until it captures. And what it's trying to do is recognize the teeth. And so you'll see there, we have the top of it that's captured in the bite, and it did a little sort of movement there, which you'll see it'll reorient itself once we do the other side of the bite, which is why it's important to do both sides. Another thing, or I'll get to that at the end. And so to go to the second side, you want to make sure you go down here and click this little box here. If you don't click that, sometimes the program will overwrite the bite 1, which again is going to cause an issue or create a cant that the patient doesn't really have. And so right side or left side, we'll start again on the upper until it captures, and then go down to the lower. Doesn't seem to wanna connect. Let's see if I can go all the way back. And so I guess it's good that it gave me an issue here so I can show you, our technique basically of how to go about this. And so right now we have, the left side of the bite scan. We're trying to scan the right side here. And so if we reset the bite, it's going to delete out everything, to where if we just clear, are you sure you want to clear the active occlusion scan? And so basically this will clear just the side that we were working on. If you were to hit reset, it would delete both the left and the right side, and you'd have to restart again. And so we cleared that out, and we're just going to give the left side another shot here. And so last time I tried going on the upper first, so this time I'll try on the lower first. Actually, I think what it is his tongue. It's capturing his tongue back here, which it's not recognizing, and so that's what's causing our problem. So James, if I could have you stick your tongue to the opposite side or try and hide it underneath the teeth on the lower. And then there we go. And so sometimes what happens is, depending on the vertical of the bite, if you don't have a big vertical, sometimes it's hard to capture the occlusion of the mouth. And so that's what the program is looking for, is a little bit of the facial and a little bit of the occlusion so that it can match the bites up. But you'll see here we have both the right and the left side. And so hit done there. It's a good idea to go in and basically look and see, make sure that it's not oriented differently than how the teeth actually are. And then moving forward, so up here on the top you have a little tooth and a little male button. And so I know that the program allows you to just basically go straight through and send this out to the lab or to your direct connect box. But what happens is in that step is that it has to post-process the models and send it out to the lab that's accepting the case. And so instead, if you go to this little tooth here, go down to the tools section and hit post-process, what it will do is it'll basically lock the model set and the bite and everything to where we've had issues where sometimes on the doctor's end, they'll see both the left and the right side scanned in, but on our end, we'll only see one side. And what happens is that something happens in the processing and sending stage to where it's doing it together, data gets lost. But we found that if you post-process it beforehand and then send it, that it avoids that issue from occurring. So we'll let that process through, and then you can send it off to the lab.
So for any further inquiry, please contact Diamond Orthotic Lab. That's diamondorthoticlab.com on the website, and direct any questions about technique or delivery from your facility to the laboratory and any steps in between. Thank you.